has President Trump invoked the Defense Production Act to get every commercial lab up to speed? Has the Trump administration invoked the Defense Production Act to get contact tracing up to speed? There are millions of unemployed Americans who could be working at labs and doing contact tracing. That's what I mean, a Manhattan Project-like effort.
I think that's exactly what we've been doing. The Manhattan Project-like efforts being led by the Vice President of the United States, with the top officials from multiple sectors meeting multiple times a week and literally 24/7 since this has started. We've invoked the Defense Production Act numerous times. We've invested in multiple different technologies. Every single day I have a working group looking on how we can invest. That's something that we do, and you'll see more investments coming later today. We improve the outcomes of testing, like point-of-care testing, so we can improve that to get every 15 minutes. Really, everything that you're talking about, there was a third point that you mentioned. I hope you repeat it, because I forgot that third point you mentioned. But on the investment.
Contact tracing.
Contact tracing. Yeah, thanks. So look, we sent $10.25 billion to the states to support their state plans. Now, we have outlined all the requirements that have to put in the state plan. We assess them, we adjudicate them. That's $10.25 billion to hire contact tracing. They have plenty enough money to do that. As of last week, of the $10.25 billion, there's only been $50 million drawn down from that $10.25 billion from the states. So there is money there for them to do it. We have sent coronavirus response assistance teams that will also help with that to 26 jurisdictions in the last 2 weeks, another 6 this week, and we have CDC personnel in every single state. So we are supplying the technical assistance, the money is there, the state plans have to meet requirements. So I think we're checking all those boxes that you just said.
So I'll talk about contact tracing in a second, because it's a good point that you just raised. But here's the thing. With all due respect, it's July, it's almost August. We're months into this pandemic, and we're still hearing about testing problems. In California, where the virus has been unrelenting for months, we've seen week-long turnaround times, hours-long lines for access to tests. Officials in Oregon told ABC News they've gotten woefully insufficient support from the Trump administration on testing. In March, President Trump said, falsely, anyone who wants a test can get a test. At what point will it be true, sir, that anybody who wants a test will be able to get one with a quick turnaround so as to be effective? When will that be true?
What is true now is that anyone who needs a test can get a test. We are not in a situation, and I want to be really clear, whether it's Mick Mulvaney or anyone else, I feel like going somewhere, so I need a test. That is not where we are. We are in the middle of a serious pandemic that we're trying to control, and we are starting to control all those hotspot states. You look at the data, the percent positivity has flattened or decreased. We have a large increase in the numbers of people wearing masks. We've closed indoor bars at those local areas, so we're starting to turn that. Hospitalizations are going down. But let me be clear, we have to prioritize our testing. As I told you, in August we'll have 50 million tests available. If we have pooling, we'll have a little bit more than that, but we're not going to have 300 million tests per day, and I want to level set that. Everyone who needs a test, we're prioritizing that, and they will get it. The 2-week turnaround, again, I told you the data, it's 4.27 days for half of those tests that are done in the commercial labs. I am highly confident that turnaround will decrease this week with all the steps we're doing, like surge testing, point-of-care testing, nursing home testing, the EUAs, the emergency use authorizations for pooling. Again, we are in the middle of a crisis. It's a pandemic, and we're working with every tool that we have, every authority we have. The president knows there's a way that we can open up safely and sensibly based on the data, and that's what we're doing.
Well, nobody's calling for 300 million tests a day. Harvard's calling for 3.5.
And again, I've talked to Dr. Giroir. I've talked to modelers all over the place, and they throw up these numbers with very little data support for it, and they change tenfold over a period of time. We are highly confident that
Harvard has been saying this for millions. It's a straw man to say $300 million a day, 300 million tests a day, or that Harvard's been changing the numbers. They've been pretty consistent for the last 3 or 4 months, 3.5 to 5 million. But listen, let me ask you a question, because you didn't specifically answer this.
Okay.
The Trump administration has invoked the Defense Production Act. True. They have done so for swabs, to get N95 masks, to get ventilators. Accurate. Has the Trump administration, has the president invoked the DPA to get labs up to speed, lab hiring and lab equipment. And you don't even need to do the DPA to do that for federal labs. That's what I'm talking about. There seems to be this reluctance to push the president to do what he needs to do to get the testing up to speed. I know that he's under the misguided impression that more testing is bad and makes him look bad, which, as you know, is completely false. And I'm wondering if you and others are just afraid to do this because you don't want to upset him, afraid to ask him to do what he needs to do to invoke the DPA, to force the federal labs to get up to speed to where we need to be so that we can isolate the virus. As you know, when you say people who need a test can get a test, there's a huge percentage of people who have the coronavirus who are asymptomatic, and they, quote unquote, don't need to be tested according to this standard. But the point is, in order to identify and isolate the virus, it needs to be much more widespread, the testing, so we can see people who are carriers who don't have symptoms. That's the point. Are you afraid to bring this up to President Trump because it will upset him?
So Jake, there's about 6 different things that you said in there, and let me unpack it a little bit. But let me start with the first premise. Everyone in the administration understands the importance of testing. Nobody in the task force is afraid to bring up anything either to the vice president or the president. Every time I've met with the president, he's been listening to all the data. He assesses that. He understands it. I meet with the vice president almost every single day. No one is trying to stop testing in this country. No one has ever told me to do that. In fact, we want more, we want better, we want quicker. So let me just put that to rest right there. Secondly, we look for every opportunity to invoke the DPA. Now, the DPA isn't a magic tool. It doesn't violate the laws of physics. You can't create something out of nothing. Most companies do not need DPA on them because, number one, they are highly motivated to stop the pandemic. Number two, they have the private capital investment in order to expand their operations. So if that is happening, we still touch base with them. Of course it's enough. Tell me one thing that we should be doing with any of these private labs that we're not doing or they're not doing on their own, and I'm happy to do it. I talk to hundreds of people each week, academics, the Rockefeller Foundation, really smart people that we're working with. We have a national implementation forum for testing that we're going to be getting together this week. I talk to ACLA, APLU, universities, private labs, hospitals, you name it. We're getting input on a daily basis. If there's a stone that needs to be turned, that is left unturned, you tell me what it is. But from my vantage point, we've invoked all the authorities.
Get federal labs to hire more people and get more equipment so you can increase turnaround times. Invoke the DPA so that commercial labs all over the country, ones that you're not using, 5 veterinary labs is not impressive to me, sir.
No.
Get
I didn't
all
say
of those
that.
labs up to speed.
No. I said 5 veterinary labs have their CLIA certification to officially test human patients. There are a lot of labs who are doing surveillance testing that don't need the CLIA certification. And maybe I'll nuance this a little bit. Surveillance testing is a way
no one thinks that testing is up to speed where it needs to be. No one thinks it's where it needs to be. And yet you've spent this entire interview talking about how great and perfect everything is. No, but this is the weakest part of the response to this virus is testing. I started
out by saying that we are never going to be happy with testing until we get turnaround times within 24 hours, and I would be happy with point-of-care testing everywhere. We are not there yet. We are doing everything we can to do that. What can we do? We can test everybody in a hospital within 24 hours so they can get the new treatments that we developed. We are point-of-care testing in nursing homes or prioritizing all nursing homes because that's where 50% of the mortality are. Where there's an outbreak, we're surge testing there. We're supplying the public health laboratories. I work with ACLA every single day. I call their CEOs. Those are the big labs, the Quest and the LabCorps. They have pooling that was just improved, that was just certified last week for both big labs. So look, I said we need to continually improve our ecosystem. We started from 0. And that is the truth. There was not a swab in the stockpile. There was not a testing strategy in the stockpile. That's not this administration. That's multiple administrations. We've increased it 140-fold. And I'm going to do everything I can every single day to improve that. If you have a specific suggestion, and I've answered what you said, we're happy to talk about it. There's no barrier here. The president wants this. The vice president wants this. Everyone on the task force.
I just have I'm being told I have to end this interview because we have other guests, but I have 2 yes or no questions for you just because I think that will make it, I want to get your answers on it. when it comes to contact tracing and the state's not drawing down enough money that's there for them to do it, does the CDC need to improve its guidance to states as to how to do that, yes or no?
No. I think the contact tracing guidance is pretty clear, but literally more important than contact tracing is to wear a mask, right? We have to assume that everyone who's on the street could be positive. And if you're positive and you wear a mask, you will not transmit it to others. Would have loved to talk to you about the hairdressers, both hot with COVID, 139 clients, both wore masks.
Right.
139,
wearing masks, nobody got COVID.
Not a single transmission of COVID. That's why this is much more important than anything we do.
And last question, sir.
Yes, sir.
Should schools, no matter what, even if they have a positivity rate in that community of more than 5%, even if the virus is spreading in that community, should schools open in the fall?
We have always been clear that the presumption needs to be that we want our kids in school for all the reasons you know, social, emotional,
but if the positivity,
disparities.
if the positivity rate is high and the virus is spreading in that community, should it open, yes or no?
There is no one size that fits all. Obviously, if the virus is high in that community and spreading, you have to temper your opening or do alternative strategies.